Hi, Namaste. I am Dr. Anamika Yadav. I am working as a pain specialist in CK Birla Hospital, Gurgaon, Sector 51. So today we'll be talking about neck pain and back pain causes and what all treatment options you can opt for. So neck pain and back pain बहुत ही common problems हैं. I think nobody is spared from a young adult to old age. Anybody and everybody can suffer from it at least once in their lifetime. So also especially in the COVID times when you are working from home, the posture is so wrong, and unknowingly we adopt such postures which leads to a lot of neck pain and back pain in people. So thing is, they're vertebrae which are like lined like this, and they have pulpous and cartilaginous material between them, which is called a disc. So what happens is, because of the wrong postures, what happens is it comes out and it presses around the nerves which supply either your arms or your legs. So depending on the position where it is compressed, if it is in your cervical area, then you can have neck pain associated with pain radiating to your arm. And also if it is like your back pain, then it is if it is compressing the nerves in your lumbar area, it will go and it will radiate to your thigh area, then to your leg, and maybe even up to your foot. So this pain is very troublesome to the patient because it limits their activity, and also we have to start some nerve medications for it, because it's a kind of neuropathic pain which happens along with the compression. Because of the compression of the nerves around the vertebrae, this happens, and there's a lot of pain which radiates to your limbs. So what are the treatment options available? I think first we can go for drug therapy. We give specific nerve related medications to regulate the proper regulation of the pain signals, and apart from that we have to give muscle relaxants and other painkillers depending upon the condition of the patient. Also then we can go for fomentation, a hot fomentation or cold fomentation, and local therapy. And then we can also opt for physiotherapy and rehabilitation exercises. But apart from, if all these therapies are not working, what can we do further? So we can go for injections. For those, we take the patients to the OT or your operation theatre, and under CM guidance or ultrasound, we target those particular nerves and put the numbing medication there itself on the nerves which are affected, so that the pain stops. And when the pain stops, the patient is able to do exercises in a better way, and so the muscles get strengthened, the pain is less, so they are able to mobilize more, and the recovery is fast. Or there is an option, if it's still the patient gets pain again after 3 months, after 6 months, again and again he is getting the pain. So there are options of if the disc which has protruded is very big and very troublesome, we can always do an endoscopic percutaneous endoscopic discectomy through skin. Also this doesn't require your overnight stay in the hospital, and it's like a daycare procedure, and just under local anesthesia it is done. No general anesthesia, no sedation is required. And we use an endoscope to pull out the disc material which is compressing your nerves. Or there is an option before going for any surgery to go for, we can do RF ablation or radio frequency ablation, or burning the nerves which, for example, there is a facet joint or there is a pain because of some joint of the vertebrae, then we can target those particular nerves there, and we can numb those first, and then we can ablate those nerves, means we can burn those nerves, and so that the pain signal doesn't go to your brain and you don't perceive that pain. So along with all these, the alongside therapy which runs is rehabilitation, that patients are told what exercises to do, not to lift heavy weight, not to bend forward, like to change their postures every 15-20 minutes, and these things go alongside with the medical therapy and or any other intervention therapy if we choose for, and it really helps. So if you are suffering from such conditions, you can come visit CK Birla Hospital. My OPD time is 6 PM to 8 PM every day except Sundays. Thank you.